everyone. This is Juliet Hammond coming your way again. Thank you for tuning in to Mort Moriah Radio. And this is Inspiring Time with me, with Juliet. I've got a wonderful person, a guest with me. He is one of our super guest speakers. You know, I like having him on my show, and we're going to be talking about a very important subject, a topic that you and me really need to know about. Okay, this gentleman, he is a professor, and he is the chairman of Board of Trustees, Hepatitis Zero Commission. He's also the chairman for Trojan Medical Group. He's a consultant gynecologist here in United Kingdom. And he has so many other accolades. I mean, he's a leader, he's a father, he's a husband, and he's a mentor to many. And I'm so glad and so privileged to have him on my show. And he is none other person than Professor Dr. Rotimi Jaiyesimi. You're welcome to my show, sir.
Yeah, thank you, Julius. Thank you for having me on your show. Quite an honor to be with you.
Oh, that's very kind of you. Now, the topic we'll be exploring, we're not going to be talking about a lot of topics because I know you have loads and loads of them that you can tell us. But we want to concentrate on hepatitis zero. Hepatitis Zero World Eradication Project. This is a project that you are leading. And before we start, what is hepatitis zero? What is it all about?
Well, most people haven't heard about hepatitis. You would have heard about tuberculosis, malaria, HIV/AIDS, and that's all in the press and the media, but not a lot about hepatitis. Hepatitis is an infection or inflammation of the liver. But the difference is that while we hear about tuberculosis and HIV and malaria, hepatitis kills more people globally than those three other conditions put together. There are about 300 million people living with hepatitis. And hepatitis, yes, I said it's an infection of the liver. And if not treated, it can go on to liver cirrhosis, liver cancer, and eventually death. So it's a condition that requires global attention. And that's why the United Nations, the World Health Organization, and some other NGOs, such as the Rotary Club International, have come together to say, look, by year 2030, which is when the SDGs, Sustainable Development Goals, come to an end, that by that year, we should have eradicated hepatitis globally. We've done it with polio, we've done it with smallpox, and we think, given the adequate attention, we can reduce or eradicate hepatitis globally. So that's how the phrase hepatitis zero came about. So that is, by 2020 or 2030, we do not want anybody to be suffering from hepatitis. So it's a global initiative involving many countries in the world, including Nigeria and including Britain.
So globally, there must be, I don't want to talk about research, but there must be some areas that have more prevalence of this kind of disease than others. Is it Africa? Do you have any idea, or does it not matter at this stage?
It does matter. The problem about data from Africa is statistics, collection of accurate data. But we do know that, for example, in Nigeria, the prevalence of hepatitis B is about 8.1%, and that for hepatitis C is about 1.1%. And these are bloodborne, especially hepatitis B. You get it from body fluids, whereas hepatitis C comes from blood contamination. So it is prevalent globally. But the difference is that in the Western world, you have screening, you have testing, and then you can have vaccination. We don't have that access to those modalities in low to medium income countries. And until enough resources are paid to that, then the problem will exist or continue. And that's why there's this concerted effort to try and reduce it.
I know there are so many awareness going on about it. First of all, you're talking about it now and raising the profile of this very thing, but who are the people on the ground already that are trying to implement whatever it is that the group, the committee have set up? As you can just talk us through some of the measures, some of the things that you want to be in place to make sure that this thing is eradicated by 2030.
Yes, I will initially talk generally,
Yeah.
then I will talk about the hepatitis zero project itself.
Okay.
But generally, most ministries of health, governmental organizations, have departments that are looking into this. In Britain, in the Western world, it's ongoing. But when you look at developing nations or low resource countries, where the allocation to health is not as it should be, then not much attention is being paid to the eradication of hepatitis. And that is where non-governmental organizations have come into the picture. I mentioned Rotary Club, and there are other non-governmental organizations globally that are trying to help supplement what government is doing or complement what government is doing. Now, the Hepatitis Zero Project initiative was started by a gentleman called Humberto Silva, who is in Brazil. And it was from a personal experience of someone having hepatitis B that he decided to take it upon himself to set up that initiative. And the initiative now has been replicated in many countries. And in each country, it's called a commission. So in Nigeria, for example, you've got the Nigerian Commission, and the president of that is Dr. Michael Omotosho. He leads the program in Nigeria. I'm just the chairman of the board of trustees or advisors. And the particular program in Nigeria is looking at every nook and corner of Nigeria. So we do have ambassadors. It's easier to get through to the local people when you engage with people who influence decisions. So we have wives of the state governors as ambassadors. We have people of influence as ambassadors. And we hope they will carry this message to faith leaders, community leaders. In addition to ambassadors, we have commissioners in the 6 geopolitical areas of Nigeria. So the commissioners really do a lot of work. They go down as far as the local government level, where we have, you could call them champions, people who go out to educate people. But it's not just about education.
Mm-hmm.
How do you pick up people who have it?
That's right.
Unless you're unwell, or you could be a carrier and not know that you've got it. More so with hepatitis B. So what we are advocating is that people should know their status. And how do you know your status? You have to present yourself for testing. Now, if you're negative, then you can be vaccinated. If you're positive, there's no cure for hepatitis B, But at least, just like HIV, you can be treated and that will keep it at bay. Hepatitis C has not got any vaccines yet, but there are tablets of medication available that are curative. So if people come forward and get tested, then depending on what their results are, you can then put in the intervention. And again, one of the good things that has happened, of course, is the availability of vaccines. Now, globally, people are advocating hepatitis B immunization for the newborn baby. Within the first day of life, you give it. Week 2, week 4, week 8, week 16, and at the age of 1, they get the vaccines. And in doing so, it offers protection to the baby and as they grow. If you have what you call the mother-to-child transmission. If you don't know that a mother has got hepatitis B, then there's the chance that during delivery, because of the blood flow, the baby might get it. And again, if the baby gets it and is not treated, then that baby is going to develop hepatitis. And that's why we are advocating screening and screening and screening. If you're positive, if the mother is positive, the baby can get treated as well. So that's what it is in a nutshell, is reaching out to people, telling them to come forward, taking away the stigma about hepatitis. People think, oh, maybe it's like HIV or that, but it isn't. One of the things we haven't spoken about is what we might call the risk factors for hepatitis.
Yeah.
Needle sharing in people who abuse drugs. If somebody has got it and you're sharing your needle with somebody who hasn't got it, then they can get the virus. So one tries to tell people not to share needles, to have safe sex, because we do know that body fluids can transmit hepatitis B virus. So again, safe sex is important. I don't want to go down the path of sex workers, but yes, they are another group of people, as well as the men-to-men people are traced as well. But there's a program for them as well to get tested, make sure they haven't got the virus, or if they have it, then get treated. So those are the key things. Prevention is important. And if we do that, gradually we will surmount and eradicate the infection.
That was well explained. But my issue here is, why is it that hepatitis kills a lot of people and sometimes it's incurable, and yet there's no program? Before this program that you're talking about, before this initiative, we seem to have gone about our lives. Everyone just keep going. There's no program out there that was actually trying to prevent any of this from happening for a very long time. And yet, this virus is a killer. Why is it that we never take it so seriously? Or did we, and we never knew?
Right. The reason we haven't taken it seriously is because it's a long-term condition. Usually the acute phase, people can present with feeling tired, muscle pain, abdominal pain, and just vague symptoms, and people get on with life. But gradually over years, it takes time for people to develop cirrhosis. It takes time for people to develop liver cancer. By the time you get to that stage, then it's too late. And usually not until people present maybe with severe jaundice And when they get screened, they now found out that, oh, all along, they've been carrying hepatitis B or hepatitis C. If you look at what's going on at the moment with COVID-19, that one is an acute illness that kills people almost, it's not a chronic illness. If you get the severe form, you may, if you're unfortunate, die in a matter of days or a matter of weeks. And that's why I think hepatitis B and C haven't got the attention that, for example, we're giving to COVID-19. But having come to the realization now that liver cancer and liver cirrhosis, which at times will necessitate liver transplant, and we know how difficult it is to get donors, I think that's where people are now saying, look, this is something preventable. This is something treatable. And even for hepatitis C, it is curable. So let us focus on these conditions. Yeah, we hear of malaria, we hear tuberculosis, we hear of HIV. So hepatitis B and C are now getting that kind of attention. And you need advocacy, you need education, and you need the political will to drive it.
That's so true. You talk about the political will, to drive it, because most of the things that we go through or see in medical health, or it always has to be pushed politically. I wonder why. Why has it got to be pushed politically? Why is it that we don't see it until they start debating it, until someone, a political person, will just take it up and start debating it? I mean, why is it like that? Why can't we just deal with it within the healthcare?
Well, I think it depends on the healthcare system.
Yeah.
If you have a weak healthcare system, issues like this may be down at the list. Then secondly, if you have a weak healthcare system, you are not investing in health. If you take African countries, for example, the advice is that each country should allocate at least 15% of their budget to health. Very few African countries are managing 5-6%. So when you don't have money to run the services, then chronic conditions such as hepatitis don't get the attention. With malaria, it's an acute problem that also kills acutely. HIV, we all know about. Unlike hepatitis, which is a chronic disease, you may not know you've got it, but silently, it's doing damage to the body. Yeah. But now that we know, and with the Sustainable Development Goal, SDG 3 is about health. And if you look at SDG 3.3, it's about addressing non-communicable diseases and chronic diseases as well, eliminating them. And that's why it's now gaining that traction and attention in society.
That's brilliant. Thank you so much. I've been listening, and I know that you carefully avoided hepatitis A.
Yes.
Why?
There are you could go through the alphabets, but hepatitis A, yes, you can get that illness, but they are self-limiting. They don't cause the damage that B and C causes in terms of cirrhosis and liver cancer. Hepatitis A exists, you've got hepatitis E, you've got D, you've got different forms, but they are not as virulent as the B and C. And that's why the focus now is on B and C. Hepatitis A, for example, is due to poor sanitation, contaminated water. And that's why we ask people good water supply, hand hygiene before you eat, clean your fruits and vegetables before eating them. But like I said, they are self-limiting and do not cause as much damage as B and C.
That's great. So how optimistic are you that it's going to be eradicated in 2030?
Well, I'm optimistic. With the Hepatitis Zero project, it's about advocacy. It's about getting the message out there. It's about using people of influence in society. And I will talk a little bit about the difference between quantitative and qualitative studies. If you go to the lay public person and say there's a virus, it's just like COVID, they cannot see it. So they need convincing that these things do exist. And the people they listen to really are the community leaders. And that's why we try and reach out to the faith leaders, community leaders, people of influence in society, so that they can talk to people in the environment about this condition, that it exists, it's real, it can be detected, and you can get vaccines to prevent you from contracting it. And that's why I am optimistic. And we do hope government as well will step up and devote money to it. There are reassurances from, in Nigeria, for example, they've done something very good in that every baby that's delivered gets the hepatitis B vaccine at delivery. But one of the problems we might face in Nigeria is the follow-up. Will they come back for the 8-week vaccination? Will they come back for the 16-week vaccination? Will they come back at 52 weeks for the final dose? So we need a tracking system, a record system, but I think we will get there. We may not eradicate it completely, that is zero, but if we can at least, it's like continuous improvement.
That's right.
Every year, you're reaching out to more people. We've got 10 years. We're in 2020, and we're looking at 2030 as the year when we'll say the world is hepatitis free. If we get up to 85% coverage, then we've done very well. If we've got 99.9%, then I think we all deserve an accolade.
It's a bonus.
Yeah.
That's good. What have been your challenges so far?
The challenges really is access to the vaccines. There's a supply chain. Low resource countries don't manufacture these vaccines. So we are dependent on supplies from external places. Pharma industries have to report to their shareholders. So the prices at times might be exorbitant. Unless you have a generic form, or in countries such as Brazil or maybe India, where they produce it cheaply, then other countries may not get it. So it's getting access to the vaccine, ensuring safe storage, because they have to be stored at certain
temperatures. Yes.
Yeah. Then making sure, you see, you could also get the vaccine, get it down to the country, but the foot soldiers who should go out may not be able to do so. If you look at where you have crises, terrorism, a civil war, how do you get to those areas where there's banditry in society? So those are part of the impediments that may not allow us to reach the target. But we will keep at it. One life saved is better
Yes.
than none at all.
Yes.
So that's why we remain optimistic.
That's great. And you're doing a wonderful job. I'm very, very pleased and encouraged by what you're doing.
Thank you.
Lastly, tell us about Trojan. You know, it sounds like CIA, you know, like a CIA, FBI. And
Now, I've heard a lot of things about Trojan. Why the name Trojan?
why the name?
Yeah, Trojan is a powerful name. But what people hear now, you know, all this computer malware virus is, you have the Trojan virus. No, it's not
Yes.
nothing to do with that. It's a strong breed. Trojan Medical Group was set up as an infrastructure group targeting Africa. Again, it's about trying to improve health services in Africa. You've been to hospitals in Africa. You've seen the state in which they are. There should be better facilities. Ambulance services are virtually non-existent in certain areas in Africa.
That's
So
true.
this is where we hope we will be able to use our expertise in any African country to help either policy capacity building in terms of staff training, whether it's infrastructure. And when we talk about infrastructure, it's not just the four walls of the hospital. You need imaging, you need laboratories, you need different things. It's a complex system.
Yes.
And each system is vital for the health of the patient. So that is where we have positioned ourselves. But the current pandemic has limited what we've been able to do. But once we're able to get out more often, we have projects lined up that we will be looking forward to execute.
Brilliant. And who is commissioning that?
State governments, it could be the private sector. We could enter into private-public partnership. We'll talk to anybody and everybody. And one of the things that we don't talk about is there are philanthropists out there who would support a well put together project, even in terms of funding, complete, it could be 100% funding, for as long as you can monitor, you're going to evaluate, you're going to give, you're going to be transparent about the funds you're giving. I think people will engage with such services. We cannot rely on government alone to deliver healthcare.
Yes.
As you know, if you take cancer treatment, for example,
It's very limited.
Very limited, very expensive. So government can't do all. And that's where the public-private partnership comes into being.
Well, thank you very much. That explains it so well, you know. And, you know, I just want to say well done for what you have been doing. I know that you're involved with MANSAC as well. I know that you are involved in, you know, bringing all of us together, supporting us. And I'm not even joking, or I don't even want to laugh about it, but I want to be very serious and specific. You've been supportive of us, you know. You've always supported us, either in your words or in being there. You know, I don't know. I just want to say thank you. I just want to say thank you, Prof, you know, for your support, for everything that you have been doing, and carry on and be who you are, continue to be who you are. And thank you for being on my show.
Well, thank you. It's a pleasure. Thank you for inviting me. And it's quite an honor. Thank you.
Thank you. And we're going to broadcast it, and we keep broadcasting it. And I'm going to invite you again, because I know there are other stuff that you are involved in. I'm going to pick one or two again and invite you back to talk us through it all, if that's okay.
Is that the menopause?
Yes. Menopause is coming.
I think you know more. You know more about that than I do.
Menopause is coming. And cause we're gonna do research here. We're gonna talk about research.
I know.
I love talking about it, and it's a pleasure. It's a pleasure, and thank you so much for being here. God bless you.
Thank you for having me, and God bless you as well.
Yes, viewers and our listeners, this is the end of Inspiring Time with Juliet. I hope you've been inspired today. We've been talking about hepatitis, and Professor Jaiyesimi have actually kind of detailed it, explained it in such a way that we understand it. So if you do see any project like that going, any screening, anything, just be involved in it, and do as they say. And let us keep safe and make sure that hepatitis 0 comes to pass in 2030. God bless you, and thank you for tuning in. This is Mount Moriah Radio, and this is your host, Juliet Hammond. Thank you very much, and goodbye. Bye-bye.
Well, thank you.
Okay, so.
Great. How did that go?